So our topic today, the psychiatry mental health disorder. In this PowerPoint, we are going to talk about some of the mental health disease like somatic symptom, or we are going to talk about the dissociative disorder, depressive disorder, bipolar disorder, and other psychotic disorder like schizophrenia or personality disorder like paranoid, then antisocial activities or borderline personality disorder, right? Before to finish this PowerPoint, we must talk about some special problem like attention deficit hyperactive disorder. It is very common nowadays, right? In the children, we will talk about autism. We will talk about some conductive disorder, right? Also including this PowerPoint. So let's go one by one. So the first one here, the um, here we said the somatic symptom, right? The first one are the somatic symptom, basically, or somatic symptom disorder or related disorder. So what it is, what the somatic symptom disorder, what are the risk factor, and what is our role as a RN or LPN? What is your role? How to take care of the patient, right? So somatic symptom or somatic symptom disorder basically form of mental illness where the patient is experience the physical manifestation that are the result of psychological factor. So here we go. Somatic symptom disorder are characterized by persistent, also complaint regarding physical illness without any supporting physical findings. So let me tell you one clinical explanation. When I work in a hospital, we found one patient. She was 18 years old. She got hospitalized because of abdominal pain. So if anybody say, I have an abdominal pain or pain in the abdomen, it is not possible to examine. It is not possible to measurement, or you do not see. It is the patient complaint, right? So when patient got hospitalized, we did each and every examination of acute abdomen or other sign symptom. We did not find anything. Although we gave some supportive treatment, after a day, patient is completely okay and discharged from the hospital. After 2 months, same patient, because that times I work in a general surgery, and general surgery clinical rotation for 6 months. Okay, so after 2 months, same patient came and she admitted in our department because of abdomen. And basically, if patient has any abdominal pain, in surgically we said acute abdomen. So maybe from outdoor She diagnosed acute abdomen and she referred to our department. So again, same thing is happened. Patient complained the pain. Senior doctor or me, or we were that time young doctor. So we find out same problem admitted few months ago. But I said, again, we examine thoroughly and give her some supportive treatment like saline, right? And patient is completely okay after 1 day. Fortunately or unfortunately, after another month, she again come in hospital with same problem, right? The senior doctor came at the morning and said, give her one placebo. Placebo means it is not a medicine, but patient thought or think this is medication, but we know this is not a medicine. We gave placebo and patient feel completely okay and she discharged. So I said, the patient complained the pain. When we examine, we do not find anything wrong. So the disease is psychological. There are no pathology, right? Some of the patients have like this. At the beginning, it is make confusion. It is really a pathological disease or not, right? So as I told you, the somatic symptom disorder, the patient complain or experience the physical manifestation that are the result of psychological factor. But when you examine, when you go for the lab test, no underlying physical pathology, right? So this somatic symptom sometimes related to conversion disorder. Conversion disorder, I said. So what are the risk factor and what is the nursing care? Before to go next, let me read this page. The client focus on physical sign and symptom and it unable to control the sign and symptom. Physical sign and symptom increase with psychological stressor. There are so many diseases, not only the mental disease, so many diseases like autoimmune disease, systemic lupus nephritis, or like other autoimmune disease, example, Wagner granulomatosis, right? So autoimmune disease basically related with some stress and infection, some environmental factor as well. So same as some psychological disease also related with anxiety, related with stress. So anxiety is a part of life, stress part of life, but we should know how to deal with anxiety, how to control the stress. If you do not know, stress and anxiety eat you. Before to eat, you have to know how to deal with them, right? So somatic symptom or some autoimmune disease, anxiety or stress play an important role. So always we should try to keep away from anxiety or the stress, right? So what are the risk factors? The risk factors are basically somatic symptom disorder. It is female gender problem. I mean, not problem, it is more common in the female. It is more common the teen and young adult or childhood trauma, mental illness, right? Mental illness means depression, personality disorder, or recent stressful event. Like someone fall in love, a good happy couple, something is happened and relationship broken. Someone out of two, one is move on, other are not, and fall in depression. So this is the trauma, right? And patient, they feel sick. The client may use the somatization for secondary gain, such as increase the attention or decrease responsibilities. So what else? The other one, we say the somatic patient or disease related to the conversion disorder. Related to conversion. What is this? Conversion disorder means the functional, it is other name is called functional neurological symptom disorder. Patient physical symptom or a deficit suggesting the loss or altered body function related to the psychology or neurological disorder. Conversion disorder is an expression of a psychological conflict. Most common conversion symptoms are blindness, deafness, paralysis, and inability to talk. They feel they're going to die, not even not talk. Conversion disorder has no organic cause. When you examine them, when you go for the lab test, nothing can figure out, right? So there are no pathology or organic cause. So conversion disorder, what are the other data or sign and symptom? Patient physical limitation or disability. If patient feel suffocated, how they do work, right? Limitation. Feeling of guilty, anxiety, or depression, or frustration. Low self-esteem, feeling of inadequacy, or unexpressed anger or conflict, right? So now question come, if your patient have this type of problem, what is the nursing care or intervention, right? Always acknowledge the symptom are being real to the patient. First priority, right? Some of the treatment can help the patient and help the patient identify the link. Identify the link between what? Between psychological function and physical manifestation. So psycho counseling, very important to deal with the patient. If psycho counseling not work, go for psychotherapy, then psychiatric medication. So as I told you, we do some psycho counseling and find out what are the identification, the link between psychological factor and physical manifestation. Also admin some medication as prescribed, like antidepressant or antipsychotic, because depression, anxiety, or personality disorder is a risk factor of somatic symptom disorder. What else? Explore the client, the need being met, assist the client to identify alternative way to meet the need, assist the client to relate the feelings and conflict the physical symptom. Also convey the understanding that the physical symptoms are real to the client. So always you have to give the importance to the patient. You have to active listener. You have to focus, show the interest, allow them to verbalize their feelings. So they think they're important to you, right? So it is very important. What next here? Explore the source of anxiety. So find it out, what are the underlying cause of anxiety. When you take a good history from the patient, a good RN can possible to figure out what are the underlying cause of anxiety, give her the good counseling, try to withdraw, right? Encourage the use of relaxation techniques. You have to explain how to do this. Use a pain assessment scale if patient complain of pain, or report or assess any physical complaint. Keep documentation. Encourage the diversional activities. So if it is psychiatric problem, then try to motivate them, try to divert their focus, like group therapy, some exercise, some yoga, meditation. Keep them busy to play a game, soccer, or watch the TV, right? Or so many participation in their communities or hospital if they stay in the long-term care. Also, positive feedbacks. Assist the client in recognizing his or her own feelings and emotion. If need or as prescribed, give them anti-anxiety medication like benzodiazepam or any other sedative or diazepam group medication. For a client with a somatic symptom disorder, allow a specific time period for the client to discuss the physical complaint, because the client will feel less threatened if behavior is limited rather than stop completely. So what next? Next disease, we are going to talk about the dissociative disorder. Dissociative disorder, right? So dissociative disorder, basically two types. One is depersonalization or derealization disorder. The other is called dissociative amnesia, right? So dissociative disorder is a disruption in integrative function of memory or consciousness or identity. Dissociative disorder is associated with exposed to an extremity or any traumatic events, right? So dissociative identity disorder, or other called multiple personality disorder, right? We have a one PowerPoint where we supposed to talk about the personality disorder, but it is a multiple personality disorder. Basically, personality disorder talk paranoid, antisocial, or borderline disorder, or sometimes personality disorder included the histrionic disorder or narcissistic disorder, avoidance, dependence, or obsessive compulsiveness. All are personality disorder that we will talk any other time. But here it is the other name of dissociative identity disorder called multiple personality disorder, right? So one patient has so many nature of the disease, like bipolar. Bipolar patient has a two type of nature. Bi means two, right? Bipolar disorder like mood disorder with a recurrent episode of mania and depression. So when a patient 1 week depressed, another week is manic, hyperactive. This is bipolar. So multiple personality means you can get so many character in one person, right? I told you the type of dissociative disorder are depersonalization or dissociative amnesia. The depersonalization patient feelings of detachment from one's body or environment, whereas the dissociative amnesia lack of memory regarding the personal information that is triggered by a traumatic events, right? So two or more fully developed distinct or unique personality exist, like good or bad both together, right? Honesty or dishonesty both in one. But I'm talking about not it is like this, different, but easy way to explain good or bad in one. The host is the primary personalities, and the other personality are referred to as altered. Like you're so good, every your society, everybody know you are super good, but suddenly you did something totally opposite of your nature. After done, again you are good, right? But something has happened. Alter the personality may take the full control of the client, altered, right? Once at a time, and many or may not be aware of other on one another. The altered may be aware of the host, but the host is not usually aware of the altered. So what you are generally good, but suddenly you did something so bad, what is not as usual. So what is usual, this is host your nature. But what is the unusual with you? This is altered nature. So now here, um, dissociative identity disorder, formerly called multiple personality, what I said a few minutes ago. The client may have inability to recall, right? Recall the important information. So Patient had chance of forgetfulness, also transition form of one personality to others. Dissociation is used as a method of distancing and defending oneself from anxiety or traumatic experience, right? So, what others? Dissociative amnesia, usually inability to remember, I said forgetfulness, or memory impairment. The client may assume a new identity in a new environment, right? And here I said the types of dissociative disorder are: one is depersonalization or derealization disorder. So alter the self perception in which one's own reality is temporarily lost or changed. So feelings of detachment from one's body or environment, feeling of detachment and intact the reality. Intervention if your patient have it. So develop a trusting relationship with the patient, then take the patient history, encouraging the verbal expression, or explore the method of coping. So you have to teach them, you have to reinforce them how to cope with the system or coping mechanism. And also we have to identify the source of conflict. So you as an RN or healthcare provider help the patient make a decision during dissociation period. You have to encourage use of a grounding techniques. Example like touching the object, clap the hands, right? All are very important for your patient. Also keep in mind when you're dealing with the psychiatric patient, it is very important provide a safety environment, safety for the patient at the risk for self-injuries or injury to or violence, right? So also we have to provide the limit and consistency, provide assist, right? Or training them for dependence and respect the need for the patient, whatever their psyche or not. Focus the client strength and skill. Get them involved in their daily living activities. Orient the client, orient with time, orient with place, orient with the environment, or recall their past memories. Provide the non-demanding or simple routine. Allow the client to progress at his or her own pace, right? Also, implement stress reduce techniques. The different patient has a different way to get relaxed. Somebody like music, somebody like get involved with other peoples to talk and sharing their ideas. So plan for individual, group or family psychotherapy to integrate the dissociated aspect of personality or memory and expand the self-awareness, right? So the forgetfulness, sometimes it is called dementia. So here, this patient has a forgetfulness, also the sign of dissociative disorder.